Yeah, that sounds perfect. That sounds
Perfect.
perfect.
Thank you, Laura. So
No.
look, the way I've thought about it quickly, and you may have your own format, and I know that you've got some slides which are perfect, is I want to start with some brief introduction, very brief, within like 2 to 3 minutes. I know everybody knows you, Laura. You're very popular, and your tutors are extremely popular. But I'll just get them to tell the name and just your roles, and then we'll move out, because I've got 5 key questions, and I'll tell you why I've got these 5 key questions, because these are the questions which both me and Laura are getting every day. And I thought if I address those questions upfront, then it may just, meet up those expectations which might be not met through the emails or somebody who's not checked their emails.
Yeah.
So
I think I'm going to open this one. So we
perfect. Thank you.
Yes.
Well done. All right.
Yeah.
So my name is Rizwan. I'll start with myself. It's more like a team huddle. Everybody's in a team. Laura likes teams work, and she's got Clay over there as well. So we'll just go through introduction. I'm Rizwan. I'm one of the consultants working in emergency medicine here in Sydney. And look, it's been a tremendous journey. I was just thinking about it, writing this question. It's been over a year we doing this. And it looks like this is one of the largest AMC MCQ course in Australia. This is amazing. And I was just going and giving somebody an introduction, going through the portal, and they were like, they were just like in awe that the amount of resources that we pulled up into those is just inspiring on so many different levels. I'll get Laura and Clay to introduce, and then we'll move to Eamon and Zahra.
Awesome. Can you guys see me well and hear me well? Yeah.
Yes. Yes.
Awesome. So my name is Laura. I'm an IMG like you guys as well. I've been in the process for a very long time, and I was also a student of Emergency Focus a few years ago, and we created together this AMC1 full preparation course that now is becoming extremely good, extremely popular because of the quality of the resources that we provide and our study program and strategies as well. And I currently work as a medical registrar in New South Wales, which is a big step for me up. And that's it. And I'm very happy to be here with you guys. And I think we can go.
Yeah.
Thanks, Laura.
No worries.
My name's Clancy, everyone. I partner with Dr. Laura in leading what we call DLM education, which is one of the components of this emergency focus partnership to run the AMC MCQ course. I support Dr. Laura with some of the administration and some of the planning and administration of this course. I also run 1 or 2 sessions during the course. One in particular that I've run a couple of times to a broad range of students, which is around exam preparation and goal setting and areas related to my field, which is in organizational psychology. And I currently work on the mid-north coast of New South Wales with the local government here.
Very good.
Excellent. Thanks, Clay. Good to have you.
We got Dr. Zahra.
Yep. Hello, everyone. I am Dr. Zahra. I'm one of the tutors, and I'll be teaching you a lot of lectures, a lot of topics. I am very happy to be here today because, especially under Dr. Qureshi and Dr. Laura, I've been working with them for like now 8-9 months, and I have taken like 2 batches earlier, and I'm so happy to be here, and I'm so happy that because what we do here is a form of critical learning, critical thinking, which I love. And not only getting through the exam, but also becoming a better doctor by having very good concepts. And I'm very happy that I'll be helping you with that, and I'll be with you through this journey. And I wish you all the luck to get through this as soon as possible. Thank you so much.
Such a good introduction. What a great free line. Good to have you on board, Dr.
Thank
Zahra.
you.
Thank you. And we got Dr. Aima as well.
Yeah, hello, my name is Dr. Aima. I'm also one of the tutors at Emergency Focus AMC MCQ course. I'm also a former student of the course, and I'll be teaching you guys a few lectures, a few topics in this course as well. So my experience with the Emergency Focus has been amazing. And I think it has helped me to develop the AMC brains, really. how to how to think, how to have a rationale, and how to have a like critical thinking, and nail this exam. So I really recommend everybody like who is listening to us to really avail this opportunity and learn
Yes,
from it. So
like,
yeah, that's about me. Thank you.
Wonderful. It
Thank
hits home
you.
every time when we hear
I
that,
think
isn't it,
the
Laura?
yeah, I think the best part about this journey will be that at each and every step you will have a mentor with you. He'll be helping you with each and every query that you have, and I think that's a blessing. I think that's the
Yep.
best part.
Yeah.
So best of luck. Thank you so
Excellent.
much.
Excellent. So, look, I'll start off with some questions then. A brief overlay or over sort of introduction is that it's more of an ecosystem. We start off with AMC MCQ. Most of you who will pass, in fact, 2/3 of you who will pass, will be able to get their first job in Australia in the first few months. Now, there are few strategies and keys that we can help you. There are a number of different courses to complement your experience in terms of CV building, application form, interviews. Plus, we've also got a workshop happening in Wollongong Hospital, which I'll be there, and I'd love to see as many of you. Dr. Laura has also joined us at Liverpool at one of the workshops. So it's always good to come and meet up some of the tutors and people who come up making all those journeys. So if you're around and you want to come and do the clinical procedures workshop, that will be our 8th actually in Wollongong Hospital. So that's on 4th of February. And it helps accessorize your experiences and credentials to get your first job here in Australia. We've had sometimes people coming from overseas, traveling interstates. And despite the fact that I'm trying to sort of expand and involve other states, it's always good to come and, have a bit of a journey and have a bit of a yarn with, with all of us. Now, the other thing which I wanted to say is that Laura has done a tremendous job. And, you don't need my approval for that. It's just when you will join the course, you'll work with Clay and Laura, you'll feel that it's not just a course, as Dr. Zara and Dr. Khan has pointed out, it's the whole mindset. It's that critical thinking process, how to approach MCQs. It's the notes, the tutoring through those notes, which will help make your own study pattern much simpler. And it's all about efficiency. Why do you do courses? It's about to make your own study pattern with your family, with your work commitments, because some of you are doctors working in different hospitals and in different time zones. It is to make you much more efficient so that 3 or 4 hours that you're getting the maximum amount of time. That, look, I need to sit down, I need to finish respiratory medicine or GI medicine today. I've got only 3 hours. How can I make the most of it? Okay, I'll go through that resource on the portal. I'll do these sets of MCQ, and then Dr. Laura's team is going to offer me all that quiz in these 2 particular topics, and then I'll be done. There's nothing else which will prepare me better for these 2 topics. Same goes with neuro, same goes with other topics as well. So this is to accelerate your own personal growth, your own learning process. Trust me, you know all of this stuff, but we are putting you in that mindset of that examination, that you need to pass this particular exam. Now, moving on to the specific of the course, Laura, I've got some questions for you, if that's okay. So
Of
most of the
course.
questions you you
Oh, but
already
I
know
think,
them.
sorry, Ori, yeah, thank you.
So I've got only 4 questions.
No worries. I think I
What
got
are
some
this?
slides as
Okay.
well to answer them.
Question number 1, which we get most of the time, is what are the specific days of the weeks and what times are you going to run your AMC MCQ course?
Very good. So I actually have this here. So it's just a little bit of intro of our course. So normally the classes run on 3 days during the week. That's normally live classes, and we're talking about live classes, Mondays, Wednesdays, and Thursdays, and over the weekend at least 1 day. But that can change a little bit depending of our tutors. And I think you guys, actually I have a couple of pictures here. So for example, this is the January, is half of the January timetable that we have. If you guys see, we are here on day 5th. The first week is a little bit packed with classes. This is due to the tutors and because we like to start quite strongly, but we might change that because it will start on the 15th. But normally, if you see, we have one class on the Wednesday, then there is a Friday session and then a Saturday. Then we got another class on the Monday, then the Wednesday and the Thursday, but then the next class is on a Saturday. So normally we'll go for 2 to 3 classes during the week, on a Monday, on a Wednesday, or on a Friday, and then 1 or 2 classes during the weekend, depending. All right, so that's normally how it goes. And then, yeah, and then normally the students get that 12 weeks of, it's a 12-week course. I think that's another question you might have.
Yep.
In total, they will have 8 weeks of portal access. So it's a total of 5 months.
5 months. So that's fine. That was the other question. How long do I have an access to portal? So that's about 5 months. The other question I'm getting asked, how do you register and pay the installments?
Yeah, so we have a link in the Emergency Focus website. So I normally share the link all the time in one of our Facebook groups, the AMC1, MCQ for IMDs group, and also in the Emergency Focus group and page.
Yeah.
And the link is there. It will just go. I can show you guys, but
I've also left the link in the chat box. So guys, it's very simple. Whilst on top right corner of Dr. Laura's slide, it says emergencyfocus.net. Just go to emergencyfocus.net. That's where all of our resources and the course links are. I know it can be a bit, it can be a bit of an issue for some people who are trying to access this from their mobile phone in a different zone. When I type emergency in my mobile or my computer, Emergency Focus opens up, but it might not be the case for you. So just go to emergencyfocus.net, click on AMC, and the first course you'll see would be AMC1 course. The other thing was that, Dr. Laura, if you can explain that the first installment, register them into the course. When is the next installment and how do they pay that?
Yeah, so we normally have this option of installments before the kind of first live class starts. And that will be the first live class of the course will be the 15th of January, because the students will have 1 week now. This is something new that we're doing in order to try to make sure all the students have access to the portal and slides and everything is ready before the first class. So next week will be that admin week. So that also gives time to other doctors that would like to join, even though we are almost closing. Like it always happens, and we always have to open more spots, but we are about to close. But there is still a week in which you can use this installment option. So that means that you can pay $800 Australian dollars now, and that will save your spot. And then 4 weeks after, you can pay the other $800.
And it's the same course. You just select
the same.
Yeah, exactly. So that'll help us simplify. So basically the link that you use, there are 2 options. There's a full course payment. If you pay that, don't have to worry about it. And a lot of you have already done that. And there's second option, which says pay by installment. So if you've paid 1 installment already of $800 to get into the course, you can use the same link to pay the second installment, and that's done. You don't have to send us any confirmation, any email. Will automatically have an access and understanding that you've done your payments. So that's very simple. Yeah. Now, the 4th question, it might be a bit technical and you may have to use your slides, Laura, is does this course have everything in terms of study resources and trial exam for me to help pass the exam? What are the books? What are the resources? How do you do that? How do you do this magic?
Well, we actually...
you may say magician never tells.
Yeah. Look, well, I worked so hard to create this course, and the tutors are actually working so hard because every course is different and every course is adapted to the latest records as well. So we put a lot of work into making sure that it's up to date. So if we can have a look, for example, what resources do we have? Well, this is our student portal. A lot of people ask me, what is the portal, Laura? So the portal is like your online course If you see here, for example, we have all of the super important guidelines from all of the sources that are extremely essential for your exam. For example, therapeutic guidelines is 100% Australian based, and a lot of the questions in the AMC regarding treatment and a lot of the management, it's from these guidelines. But in order for you to get a subscription for this, you need to pay $600 to $700 a year. But we have it because we are working on registered doctors in Australia, so we have access to the guidelines for you. For example, if you see here, cardiology study materials, we have 31 guidelines, which you can go, you can see, you can read. But on top of that, all of our slides from our classes are a summary with questions, with all the theory, with everything that you need to actually study, and not you don't have to go anywhere else. Like, we give you everything. We have selected everything. We got all of the topics that you need with all of the pathways and everything there, and it's all in our portal. As you can see here, for example, this is a class, so you're able to see there one of the recordings of the classes, but in this case we are showing our slides as well. So this is how the portal works. That's Dr. Umar there giving us a class of GAT part 1, and yeah, the quality is absolutely stunning. It's amazing. It's very well organized. It has all the questions plus recalls and everything that you need. All right, so that would be and this is awesome as well. We have complete full access for as teaching a license for an app called Complete Anatomy 19, because I'm also an anatomy lecturer, and I add all of these videos. I create videos using the 3D app for my students to be able to learn orthopedics and neuro, for example. All right, so that's for just an example of one of the other classes. If you see here, it's the orthopedic surgery part 2 lecture recording, and that's how you're gonna be able to see it in your portal. So if you actually miss a class, for example, you can always go to the portal. If you don't, because you're in a different time zone, you cannot go to those live sessions, so you can only make 2 or 3 live sessions a week, for example, you can follow through the portal straight away, because all of the classes will be uploaded there. We have a lot of video classes as well that the students have to go through. And what else? Well, we have lots of mock tests. If you have joined, if you're already one of our students for January, you probably have received a small mock test. We give it to everyone, so you guys can have a feel of what the mock tests look like. We make you a bit scared because you might not know the answers. Of course, you are not supposed to answer that correctly, but this is a screenshot, video shot, let's say, of our mock tests and our Q bank as well, which is done by us based on most recent recalls, and you have lots of them, lots of them. So if you see here in the timetable, you can see how we not only have theory classes for all of the subjects that you are required to study, based on all of the materials and everything organized and given by us. You also have lots of practice and homework. So for example, in week 1, you're going to receive your homework 1, then you're going to receive your homework for week 2, which will correlate with the subjects and the topics that you are studying. And you have to answer them. You should actually try to keep up with this practice, because we allow you to acquire the knowledge much better. We got homework, and then we have the mini mock tests. So the mini mocks are actually on that form that I just showed you. And if you see here, we got one mini mock here, another mini mock, another mini mock, another mini mock, and they keep going all throughout the course. All right. There is a 2-week holiday there to catch up after the first month, because we always see that the first month is pretty heavy for the students. So then they have 2 weeks to catch up, to get through all the mini mocks. And they have a very big mock test from the first part of the course at the middle of that first holiday. All right. And then you guys will have a humongous mini mock as well, a humongous mock test at the end of the course too. And this is an example of our slides, how you are actually going to see the classes like that. We're going to share the slides on Zoom. You'll be able to see them. We have our videos that we have created to show you everything that we need you guys to understand really well. remember that you are not just learning for the AMC exam, you're actually learning to pass your interview questions, to actually be a functional working doctor in Australia, to be able to pass your work-based assessment or clinical exam. So you have to use this time to prepare very, very well. All of the things that we put here in yellow are answers for questions or recalls that have come in the exam. All right, so it's pretty much like that. I think
so somebody's just asked a question. Are we able to download these resources or slides? And I'll answer this question. The whole portal is designed to be seamless within a context of slides, lectures, and videos. So as such, we don't allow any downloads. This is because of the reason of copyright, and plus a single downloaded lecture will not make sense to you. So you will have an access to portal for as long as you need it. If you need to extend your portal, you call us or contact us and we'll extend your portal membership, because it's like a book. You cannot tear a book pages and say that, look, can I use those pages later afterwards? It is a book to be read chapter by chapter to make a complete sense, to organize your thought process. As Dr. Zara was saying, it's that critical thinking within the context.
Exactly. And also we do offer you guys some content that is downloadable. So those are my notes. All my students have my personal notes and my recall-based notes. Those are excellent notes. It's absolutely amazing, and they receive it and they can download it later on when they finish the course. And they are divided by subjects, and it's a mix of guidelines all put together. And we also, I mean, the guidelines are online, for example, from different websites. We can give them to you because they are online, and we just give you the links as well. So you can ask for them too. But our slides and our content is available in the portal as your second. So the portal will become your best friend. So it's where you go, you study, you take all the notes, you read everything there. All right. It makes things heaps easier. All right. You don't want to start like having a lot of documents and a lot of content that at the end you're just gonna drown in it. I just wanted to show you guys, and Dr. Rizwan, all of these books that we have here are books that are really good for the preparation of the exam. But I just wanted you guys to know that all of our slides are made with all these books. Like everything that we've done, it's collect every topic, everything essential, everything from each of these books, and it's in our bibliography. So we have done a massive research, a massive compilation to create this course, and all of these sources, which are essential for the AMC exam, are in the slides, all organized and ready for you, not to waste time into creating your own studies, but just to study. That's what we are here for. All right. Yes.
Perfect.
So, yeah.
That's excellent. And I think just taking on that point further, and I know there are lots of people who are coming from different countries and also from different skill set. There's one doctor who approached me at work yesterday whose partners was a psychiatrist working in Sydney and has to sit AMC Part 1. And she's actually just registered, Laura, last night.
Oh, perfect.
And I was trying to sort of highlight that, look, no matter what your background or clinical knowledge base is, you will also feel that this course is designed to take you from the very basics and leading up to the level where you're comfortable to pass this exam. All right. So yes, this is something which you can easily accessorize your pre-existing knowledge, no matter what the clinical background is. Now, there's a question from someone. I think they may have come and joined. Do we get recorded classes if you miss the live session? Of course, through the portal. Yeah. All right. I'm actually pretty much done in terms of all my questions, unless and until somebody of the audience have got any questions. We got about nearly 90. Please give us a strategy. So questions, there are questions coming in. Please give us a strategy to adapt good study habits so as to not to fall in a trap of shortcomings or a day-to-day family life. I think that's Clay's department in terms of organizing and optimizing your time. So I might just get Clay to just give a brief highlight of to shed a little light on your organizational workshop that you do.
Yeah, look, it's a great question, and I'm sure it's one that everyone is considering. Look, the best thing that you can do is begin planning a schedule right now, you know, similar to what you would potentially do with a budget, right? If you're setting up a budget to manage your finances over a period of time, right, or consistently over a long term. What we would recommend you do is essentially have a weekly planner that you can apply, you know, week to week or month to month, in which you're going to isolate, okay, I'm going to be working here either at the same time, or perhaps you're working shifts within your job. That's fine. You know, making sure that you're allocating necessary family time, you're thinking about how many hours that you're actually awake per day. It's one of the strategies that we do when we're doing kind of goal setting, particularly in advance of an exam. So, you know, if you're saying I'm sleeping 7 hours per night, or 6 hours per night, or 8 hours per night, I'm awake for X number of hours per day. Over that period of time, I'm traveling to work over an hour, I'm working for 8, 9, 10 hours. Allocate that. How much time am I going to spend with my family, and at what key moments during the day am I going to need to do that? What other essentials do I have? And then just considering within those timeframes, when do I have, you know, maybe it's 3 hours as a priority to watch the lecture live. When I can't watch it live, where are going to be the alternatives in which I can watch an hour here, an hour there, an hour there? And it's all about just making sure that you're doing this in advance. And that's why, you know, we've adapted and had this admin week form a critical part of your, you know, initiation, if you will, right? So what I would say is, over the next week, try and make sure that you're actually doing so. You're sitting down and you're looking at your schedule week to week, and just making sure that you're dividing up your time fairly between the things that are a high priority, like this course, and a lower priority, as a, you know, as far as they're changing with the start of this course, whether that's your social life or your family life, small modifications that you're going to have to make. And I would just say, as a final thing, make an effort as you start this course to have very open and transparent and constructive conversations with the people around you, to say, I'm about to undergo 3 months of serious study, right? Or 4 months or 5 months of serious study. I want you to be with me on this. I want you to be supporting me. And in order to support me, you know, and this could be your friends, or could be your family, I'm going to need to do this. I'm going to need to take this approach, where I'm going to need to allocate this time and this time. And I'm going to have to pull back from some of the stuff that we do regularly. That's kind of my bit of advice.
Yeah.
Thank you, Clay. I think that was
Amazing.
very helpful.
Dr.
Question
Dr.
number 2.
Yes. Can I go through the questions quickly?
Let's do that.
I'll be able to answer them quite fast. So,
Okay.
yes. So I got here a question that says, do we have any crash course available for a period of 10 days? No, there are no crash courses. I do not believe that a crash course will... Crash courses don't make you pass the exam. This exam is extremely difficult.
Yep.
The hardest exams. Dr. Sarah, do you want to say something?
Yeah, I was just trying to answer the question that, as Dr. Qureshi already mentioned, that we're going to take you from basic knowledge to specialist knowledge. For example, if someone is working in ophthalmology, he might not be aware much about what's happening in obstetrics. So we're going to, with each and every subject, in each and every lecture, we're going to start from a very basic level, and then go through the whole, you know, it will be, and then go to the specialist level. So it can't be done in 10 days, and it's not a good idea to do that. Yeah, it will be a waste of your money, and yeah, you know, it's not good.
Not at all.
Yeah.
And remember, the AMC is becoming harder and harder. Why is it becoming harder, and why do we have such a... it was 50% passing rate 3 years ago. We are currently of a 47 to 46% currently.
Yeah.
And it is because people are not preparing well for the exam, and the AMC is actually testing in a lot of different topics with a lot of varieties of detail. As Dr. Sarah said, you might get a very basic question, but then you might get questions that are extremely difficult. And you need to know exactly what those topics are, because there are so many. So yeah, crash courses, I don't agree with them. I think our course is very intensive. it is it's a lot of work. So it's 12 weeks, and that will answer another of the questions that we have. So 5 months course. So the question is here of Curat. So it's not a 5 months course, it's a 12-week course. But we give you extra 2 months, extra 8 weeks of portal access. So you can review, revise, go back, watch the lectures that you have missed, do all your homework, your mock tests, and practice. And you'll have us, you have your messenger group, your Telegram group, etc. So it's 12 weeks. So in 12 weeks, you have to be ready to acquire a lot of packed knowledge.
Yeah, that's the best part, actually, that you're not alone. You will have your fellows and your mentors with you. So all of us will be motivating you to go through this.
That's the
amazing.
best part, isn't it? Yes.
Yeah.
How many hours per class?
Yes, so it's normally 3 to 4 hours. Some of the sessions, like Dr. Sarah's, she covers humongous.
Yeah, my lectures are like around 4 hours, but 3.5 to 4 hours. Yep.
So that is pediatrics,
but we have small breaks. We talk about other things, like I know the concentration is up to, after 45 minutes, you lose your concentration for doing anything. So I stop and I talk about how to, I try to motivate and talk about study techniques of other students and ask them if they can share their technique with others. So we have a very, very interactive session and we enjoy a lot. Promise you. I mean, it's amazing.
Yes.
Yeah.
Can you show us how to get into the portal? It's easy. You'll get a detailed instruction with a passcode to get into the portal, where the links, same. If you go to emergencyfocus.net website, there's a tab there which says portal. I've simplified it. You click the portal, you open AMC1, and then follow the instruction that you'll receive through email. So don't worry about it. You'll get all the instruction in a stepwise manner. And you'll follow them and you'll be in the portal. Same goes with the app. For the app to be working, you need to be registered with the portal first. Now, our website where you register is a different website, and the website which is hosting the portal is a different website, because Thinkific is a platform which we utilize as a second party, because it's designed to integrate all that learning experience with videos and text and the mock exams and all of that kind of jazz. And the third party app which you can use your mobile phone on your tablet is through the Thinkific. But it can easily be done if you just YouTube it, how to download Thinkific app. And if you're already registered onto the portal, it will automatically sync onto your app to the same details. I mean, perfect.
And to answer a few questions as well, Dr. Rizwan, regarding when do we get portal access? So for our students that have already joined, now next week is the admin week. So all of you will end up having access to the portal mid to the end of next week. So that week is there for you to get everything ready, organized, and for us to help you navigate before your first class. If you have not joined and you want to join, you will get access the same next week or just soon after you pay your installments, if we still have spots available. And then let me just see, maybe we got lots of questions coming up. What is the AMC Recall Saver course? Wow, the Lifesaver, it's called Lifesaver course. It's an amazing course that we're doing. It's a complement to this big theory course that we have. So the Lifesaver Recall course, it's a 3-day course that it's done in the middle of the exam week. And we pretty much, our tutors do an amazing job solving all of the new recalls coming up. And they just solve them and explain everything for you guys. So would that Recall Saver course really just give you the pass of the exam? No, it won't. If you have not studied anything, if you have not done your theory, it won't help. But if you have done the big theory course and studied properly and done the hard work in advance, then the Lifesaver will really be really helpful for you to review those hours before your exam, the day before your exam, etc. All right, so it's a complement. It's very popular, and our students have the option to which we're going to start doing this next year, to actually subscribe and have access to the October, November that we've done, and then February, March, but only for our students, the ones that have already enrolled in the AMC1 complete prep course. All right. If not, you can just access the Lifesaver straight away.
I'm actually live on the website as well, and I've got heavy traffic there on the website. And I've just seen in the last few minutes, we've had 3 registrations. So we're very close to close
Amazing.
now.
You're gonna close.
Yeah.
Yeah.
We're very close to close now. And look, guys, I think we're going to be very disciplined from that point of view. I think, Laura, we always get those last minute requests that can you let us in? And we can't, because we want this experience to be an individual experience for everyone. Having that many number of participants, I know it's a privilege. I know it's a very big opportunity for us to work with all of you. But then again, we need to maintain a set number of students, because we want to ensure the quality. We don't want to overwhelm our administrative capacity, overwhelm our teaching capacity. It just becomes very difficult to handle. So if you're thinking of joining the course, please do that. The website will close automatically. And this time, I think, Laura, I'm sorry to say we won't be taking any more registration after it closes that number.
Yeah, we'll have to stop. It just becomes very hard for us. I mean, we're trying to help everyone, but it just becomes so much. Like, remember that we are different from everyone else. We actually working doctors. Our tutors are overworked. We are overworked.
And plus, there's, I mean, don't get me wrong, there is an administrative staff, but once we've done our administrative batch of things on a certain date, and you come back after that administrative stuff is gone, then it's very difficult to replicate that same administrative responsibility, set it in the same number of emails and the steps and the portal and the login. You can't get in. It just becomes very overwhelming for our administrative staff as well. So we've got a dedicated administrative staff. And then you miss on the lectures. It just becomes a rat's chase, you know. All right. Okay.
Dr. Rizwan, can I just show? So I just wanted to show this. I'm very proud of this part. It's our reviews. Like
sure. Please go for it.
Collected. And I just wanted you two guys to see that, you know, our students are very happy with us. We have multiple reviews from many students that we had this year. We put everything into this course. We really look after our students. We look after our tutors. Like, our tutors are there. I was a tutor for other companies and I hated it, but we make sure that our teachers, everyone is well, and they are okay. Like, we're very flexible. And so that means that our classes are good, and we just put in everything in it. And that can be, you can see, you know, like, we have so much, like, our students are really loving, and
I think this goes on showing, Laura, this is a teamwork. It's not for just one of us. It's for Laura, it's for Clay, it's for Zara, it's for Kana, it's for everyone who's here and are not here. Because everything, it's even for the administrative staff, because they're all putting an effort to make your experience worth a while. And yeah, thank you for that. These are independent reviews on Trustpilot, so we haven't influenced or doctored any one of them.
No,
we don't do that. These are not these are not like, okay, can you do this and write that? No, these are independent review on Trustpilot. You can jump on trustpilot.com and you can have a look at an emergency focused reviews.
Yeah.
Yes. And I would like to add one thing, that Dr. Laura is always there. Even in the study group and personally as well, to support, not just for the study purposes, but also if you're feeling down and you're not feeling like studying and you need any help, any kind of help, she's always there to support you. And I think in this exam, sometimes it becomes really overwhelming with all the knowledge and everything. It gets really overwhelming, and the exam stress. So it's really important to have that support. And emergency focus, especially Dr. Laura, she really puts effort into that. And I think when I was doing my exam, it really helped me, and I reached out to her, and the way she is with her students, it's absolutely amazing. And I have not seen this in any other course like she does.
No, I agree with that. I would absolutely second that. I would send a message if I'm panicking about something on administrative fund at like 10 o'clock or 12 o'clock finishing my shift, and I'll get a message. Pretty straightforward. So I love that communication. And
Yep.
I know it can be very difficult because, as Laura said, we're all working doctors, but I think that mode of communication, that continuity, I'm very proud of that.
Yeah, she's going to be your best friend in few days, I'm sure.
Yes, that's
She's
for sure.
amazing and she's
Yes.
approachable. I love that.
Thank you
Okay,
so
so
much.
shall we do some quick trial questions,
Okay,
guys, and
questions?
close the session?
Yes, so let me see if I think we got them here. Is this the first one coming in? Yeah, so I think Dr. Sarah will do the question like she normally does in her classes.
Yep.
Mhm.
There you go.
So I'm going to read it now. Anthony is 71-year-old patient who presented to your clinic complaining of pain in his left shoulder that started in the last few months and has gotten progressively worse over this time. He described the pain as a dull ache that radiates to his axilla. As he speaks, you notice that his left eyelid is droopy compared to the right side, and the left pupil is smaller than the right. You inquire about his medical history, and he informs you that he has smoked 1 pack of cigarettes per day since he was 14. He jokes about his weight, noting how easier it has been for him to lose weight now that he is older. Which one of the following is the best investigation for the cause of his symptoms? A. Brain CT. B. EEG. C. Duplex of cervical vessels. D. Chest CT. And E. PET scan. So basically, we have I always tell my students to imagine that you're sitting in a GP clinic and this patient has come to you. That way you can remember it and also, solve the question as well. So he's a 71-year-old patient. His main complaints are pain in the shoulder that is getting worse, and it's also radiating to the axilla. And what you notice on examination is a droopy eyelid on the left side, that's basically ptosis, and a left pupil that is smaller than the right. That's what you can call is a constricted pupil. And the other history is that he has been a chain smoker, as he has been smoking since he was 14 years old, and now he's 71, so chain smoker. And he jokes about his weight, that how easier it has been for him to lose the weight, which means there is a history of weight loss. So putting together all these symptoms, it's basically, can we go to the next slide, please, doctor? So putting together all these symptoms is basically a Pancoast tumor. What Pancoast tumors are, they're basically lung tumors that are present on the apices, or in simpler words, you can say in the top portion of the lungs, in the superior sulcus of the lungs. Due to their position, as they're present on the top part of the lungs, due to their position, they have a mass effect. Mass effect means that there are certain nerves running behind them, and they press upon these nerves and vessels, due to which these symptoms, the patient presents with these symptoms. For example, there is brachial plexus running at that part of the, as a vertebra. There is sympathetic chain, and there are some other vessels like superior vena cava. So if the one by one, if the sympathetic chain is being pressed upon by this tumor, by the Pancoast tumor, the result will be a Horner syndrome. So what is Horner syndrome? Basically, the patient will present with ptosis. You can see in the picture the droopy eyelid, and then miosis, which is constricted pupil, and ophthalmos, which means there will be a posterior displacement of the eyeball. You can see one of the eyes is posterior as compared to the other. And anhidrosis means absence of sweating on the one side of the face. So all this together will form Horner syndromes. This happens because of the Pancoast tumor pressing upon the sympathetic chain. Then, because there is other nerves going on that part of the on that part of the vertebra as well, behind the lungs, for example, brachial plexus. So if brachial plexus is being pressed upon, especially the ulnar nerve, as it goes on the medial side of the arm, what will it cause? That the pain that is happening on the shoulder will be referred to the shoulder, referred to the axilla and scapula, and also there will be pain around the medial border of the medial side of the arm, and there will be wasting of muscles on the ulnar side of the hand. So along with this, as it can also press on recurrent laryngeal nerve that is running in this area as well, it can cause hoarseness. And as there is superior vena cava being pressed upon as well, so there are some nerves and also some vessels. So when superior vena cava is being pressed upon, there will be pooling of blood in the superior vena cava and it will cause flushing and edema. So in short, there will be a mix of symptoms, but nothing related to the lung tumor itself. Patient will not, he might not be presenting to you with cough or shortness of breath or the typical symptoms of a lung tumor. He will be presenting to you because of the mass effect of the tumor that it is causing on certain nerves and vessels that are going around. So yeah, the answer is, so the diagnosis here will be Pancoast tumor. There will be some lymph node enlargement as well. So the question asked us what will be the most appropriate test that we need to do. So the best initial test and most appropriate are two different questions that AMC wants us to answer. So the best initial will be X-ray, as we are suspecting a tumor. So we will go from simpler to more, a more advanced test. So the first test will be a chest X-ray. Then we will go to the most accurate test will be a CT scan for the tumor, as it will show the location of the tumor, and as well we can stage the tumor, and we can also see the infiltration of tumor inside the lungs and the mass effect. And if this tumor can also metastasize, so in that case PET scan, but here the most appropriate test will be CT chest. That's the answer. If you go on the next slide, I can show you the CT scan. This is the CT scan. You can see the uh, actually I don't have my pointer, but this is the tumor. The black portion on both sides is the lungs because there is air inside. The middle thing, the black small hole, is the trachea, and this is the vertebra, as you can see, and the tumor is present very close to the vertebra, where the sympathetic chain, the brachial plexus is coming out of the two vertebrae. So there, these will be pressed upon, and they will cause the symptoms that Anthony had. And so the best and most appropriate test will be a CT scan, and the first imaging test will be X-ray. And depending on the stage, we will treat it, sometimes radiotherapy and chemotherapy to shrunken the tumor. And once it's shrunken, we go for surgeries. So yeah, that's all. If you have any questions, you can just, tap them.
There
That's
you
very
go.
good.
Thank
Very
you.
good. And I think
Thank you.
I just like to make a point that even, having done this exam almost, I don't know how long ago now, but you still click off with the Pancoast tumor name in your mind, and it's
Yeah.
causing the irritation to the brachial plexus and all that kind of jazz. I think
Yeah.
the important thing, as you've described, Dr. Zara, it makes it so relevant. It's not about the diagnosis, but actually what is causing this issue is about the issue of extension of tumor involving the nerve, causing the Horner syndrome involving the cervical sympathetic
Yeah.
chain. And I think this question, which I want everyone to understand, that the question or same theme, I would like to say, can be twisted with the same concept. So
Yep.
they may give you a scenario in which the patient is not presenting with the Horner syndrome, but a history of smoking, but with some back pain and ulnar symptoms.
Yeah.
So smoking ulnar symptoms would again trigger you to think about this test. And the reason Dr. Zara saying yes CT is because of the metastatic effect, because we want to look at where the tumor is encroaching and affecting to have those effects.
Yep.
Very good. Very well done. Thank you very much for that.
Thank you, doctor.
And just to point out, it's super important in the questions for the AMC to actually read what they are asking. So that's why Dr. Sarah was saying best initial or most appropriate. They use these words, and if we are not trained, if no one tells us exactly what it means, then you answer the question wrongly. All right.
Yep.
So
what I used to do when I was doing the MCQ, and I've done lots of them, is to hide the options from the view and just read the scenario, think about the options in my head. Because the scenarios can sometimes, like the options sometimes can confuse you from A to D, but just thinking blindly about what could be the option, like I would think CT chest, and you find a CT chest, you've got an 80% chance in terms of statistical value of having your gut feeling as the right and correct response for that.
Yeah.
So there you go, my golden tip.
Yeah, that's a great tip. It's a fantastic tip. Yeah, 100%. All right. So do we have time for one more, I think?
Let's do that.
One more. All right.
Yes, so
Dr.
I'll do
Ryan.
this question. Yes, I'll do this question. I'll read it. So it is a 4-year-old boy that presents to emergency department with a complaint of palpitations and fatigue. And there is no history of such presentation before. On examination, the patient is irritable but conscious and oriented. His vitals are pulse 220 beats per minute. Blood pressure is 90/60. And respiratory rate is 25 beats per minute. Temperature is 37. And oxygen saturation is 98%. An ECG is performed as shown. Which one of the following is the initial management of this patient? So the answers are, so the options are carotid massage, vagal maneuvers, IV adenosine, DC cardioversion, and IV verapamil. So first and foremost, we need to see what is the age group that we have in this question. So it's a 4-year-old boy. So this is a pediatric age group. And then we see what is the hemodynamic status of the patient. So in this question, patient seems to be hemodynamically stable. The patient is not in shock. Although the blood pressure is 90/60, but it's the normal blood pressure in the pediatric age group. And also the respiratory rate is 25. It's also normal. The temperature is 37 and saturation is 98% normal. Only abnormal thing we see in this question is this pulse rate, that is 220 beats per minute. And also if we look at the ECG, we can see a fast heart rate, which is a tachycardia or tachyarrhythmia. All right. So in a normal ECG, we see a P wave, then a QRS, and then a T wave. In this ECG, we cannot see any P waves. We see narrow QRS complexes. All right. So what is a narrow QRS complex? A narrow QRS complex is the QRS complex less than 0.08 second. All right. So a normal QRS complex is 0.12. And if any QRS complex is more than that value, then it is a broad QRS complex that is abnormal as well. All right. So that would be mostly in the case of VT. In this question, we have a diagnosis of SVT. First thing is to make a diagnosis. It's a supraventricular tachycardia that we see here. So the classic ECG features in a supraventricular tachycardia is the absence of P waves. It's a regular rhythm. It's a fast rhythm, and mostly a fixed rate of more than 220 beats per minute. So it's a very common tachycardia that happens in infancy and childhood. And the more than a third of new onset SVTs occur in the first few weeks of life. And vagal maneuvers should be attempted first, but only in the patients who are hemodynamically stable. So SVT is basically in younger children. It is mostly because of the atrioventricular re-entry mechanism. This is the most common type of SVT. But Wolff-Parkinson-White syndrome can also be there. It is basically structural abnormality that is present congenitally, which causes SVT. All right. So SVT, we always assume a broad tachycardia is due to VT. This is one more thing, rather than SVT with aberrancy. So one more thing is important, that we have to rule out the other causes of tachycardia, which could be the patient could have sepsis, pain, dehydration, anxiety, or fever. They should be considered as well before making a diagnosis. So there was no such history in this question, which was suggesting any of these findings. Next slide, please. All right. So when we make assessment, as I have told before, we have to make sure the patient is hemodynamically stable and is not in shock. All right. So there are two groups, even in pediatric group, there are two groups, the infants and the children or adolescents. The infants present in a different way as compared to the children. So infants, because they tolerate tachycardia well, and this makes the early signs very subtle. And there is mostly the parental concerns of initially irritability or poor feeding, lethargy, or sweating, and they usually present late with the signs of congestive heart failure. As opposed to that, in the children, they're usually able to perceive the palpitations. So the parents would present, these patients would present earlier as compared to the infants. So the child would feel ill, breathless, the child would have chest pain, nausea, dizziness, or vomiting, and the examination may be normal because they are presenting early. So we always have to look out for the red flags as well, which could be unwell appearance, hypertension, drowsiness, and altered conscious state. Let's go next slide, please. Yes, so diagnosis is basically on chiefly on ECG. So SVT usually presents in paroxysms. Like if the patient is presenting to you, sometimes it happens that patient is presenting to you and you may not record anything on ECG because this is the nature of SVT. It can occur in paroxysms and it can be continuous as well. So in that case, we do ambulatory monitoring where so that we can catch up an episode of SVT. So the average duration is mostly 10 to 15 minutes. It's a regular rhythm. In infants, it's 220 to 280 beats per minute. In older children, it could be 180 to 250. And if the patient is hemodynamically unstable, instead of taking a 12-lead ECG, you just take a rhythm strip, just to rush to the management and not make a delay. So for the patients who present with SVT in early infancy, it can resolve by 1 year of age. Next one. All of this is from UpToDate. I have utilized UpToDate and RCH guidelines for this. RCH guidelines are the best for the pediatric pathologies and problems. So this is a typical ECG for SVT. You can see the narrow complex tachycardias. Again, when you see an ECG, you have to first rule out if it is a tachyarrhythmia or not. If the QRS complex is narrow or broad, or P waves are present or not, or the rate is fixed or variable. So you have to make the diagnosis depending on all these findings that you find in the ECG. And also the chest X-ray is not as much helpful unless there are any other pathologies or any other blood tests. So it's chiefly on the patient symptomatology and the ECG findings. Next, please. Okay, so now let's go to the management of this patient. So first we do vagal maneuvers. In a hemodynamically stable patient, as I said, we start from vagal maneuvers, and it's also different how you do it in different age groups. Like for neonates, I got this is actually a very hard favorite topic for AMC. I've seen so many questions for SVT. In one question, they changed the age. In one question, it was 9 months of age for that kid, and then it was like they changed the management. Like what was the as Dr. Rizwan and the other Dr. Zahra said, they changed the last line. What is the initial management? What is the most appropriate management? What is the best management? Or they could ask you about the investigations in the question. So for neonates, it can we elicit the diving reflex by facial immersion in the ice cold water for 5 seconds. So, but it is safe and it is 90% effective in terminating SVT. For older infants or toddlers, we apply ice cold face cloth or bag filled with ice slurry to the face for 15 to 30 seconds. It also elicits the dive reflex. For the school-age children, because they are able to respond to the commands, so that we ask them to blow on their thumb or 10 ml syringe on full inspiration for 10 to 15 seconds, and there should be no air escape. The child should be seen to strain. That's how we do the vagal maneuvers in different age groups. Next one. And also, it's not recommended to do eyeball pressure or carotid sinus massage in the pediatric age group anymore. All right, if the patient is not responding to the vagal maneuvers, then we move on to the adenosine. So adenosine has a therapeutic as well as diagnostic value. So it has a short half-life for 5 to 10 seconds, and it works by briefly blocking the AV node conduction. And you record a rhythm strip when you are administrating the adenosine. There are some side effects that you should be aware of, and you should counsel patients according to that. That they could experience transient flushing, they could have chest discomfort. These are relatively common side effects, and especially if a patient is asthmatic, has a history of asthma, or is experiencing a wheeze at the time of the SVT episode, then it's better not to use adenosine, and you consider the alternate options. So there are some contraindications as well. If the patients who are taking dipyridamole, you give a lower dose. And for the post-cardiac transplant patients, especially because they have a denervated heart, so they don't have the compensatory mechanisms in them. So there could be a risk of asystole or sustained bradycardia. So other considerations are like for children who are using theophylline, you consider cardiology for that as well. So the verapamil is not used for children, usually not used in children less than 12 months of age, because there is a risk of irreversible hypertension and lethal ventricular dysfunctions. Next. Next slide, please. So this is an algorithm. Like if a patient is presenting to you in shock, it's hemodynamical and dynamic instability. You see, if the patient is presenting, then there is a different pathway. And if the patient is stable, then there is a different pathway. There are different priorities how you manage the patient. So first, if a patient is presenting with shock, then you give oxygen, always ABCD approach. Oxygen, then vagal, then you do the first line, vagal maneuvers, then you go immediately do DC cardioversion. That is first with 1 joule, then with 2 joule, and if there is no effect, you call for help. And then if the patient is not in shock, then you take a 12-lead ECG, and you do vagal maneuvers. Then if there's an ongoing SVT, then you give IV adenosine, and you give different doses and different values of the doses, like 0.1 milligram, then 0.2 milligram per kg, then 300, then 0.3 milligram, depending on how your patient is responding. But if at any stage here the patient is reverted, then you again do a 12-lead ECG to look for pre-excitation and other abnormalities. And it's administration of adenosine should always be done by a very experienced staff available. Okay, and you should inform the parents, as I said, because the patient, they can be very overwhelmed by the side effects. The child can feel flushed, or they have chest pain. So it's important to counsel the patient, the parents always about the side effects as well. So yes, next one. So you should always consider consultation with the local pediatric team in a pediatric age group patient. When there is a first presentation of such case, like in this patient, it was a first presentation. So the patient is under 3 months of age, patient has heart failure or history of heart failure, or it is requiring a DC cardioversion. It's not reverting with a medical cardioversion, that is with IV adenosine or with vagal maneuvers. So you consider transfer if the capability of the facility is not as much to manage such patients, and you consider discharge. If the patient is reverted on its own, because sometimes it happens that SVT can revert on its own. Sometimes it can go on and need the treatment. All right. So in that case, if the SVT has reverted on its own, and then there was no need of any intervention, then you just keep the patient admitted and observe for 90 minutes, and then you ensure the follow-up. Yes. So that's it for SVT.
Perfect.
Thank
Now,
you.
I just would like, let's just keep slide over here. Now, there is one practical tip which I'd like to give you, because as an emergency physician, this is something which we see quite a lot of time, and I'm pretty sure that you may have already seen that in your workflow. There could be a little bit of confusion about carotid massage and vagal maneuvers, because technically speaking, carotid massage is a vagal maneuver. Okay, so when you talk about vagal maneuvers, there are only 3 key things. There's vagal maneuver via the carotid massage, there's dunking of your face into a cold or ice chilled water, and there's also, a Valsalva maneuver in which you try to push the plunger of and the concept behind the vagal stimulation is exactly the same. You're trying to overstimulate the SA node by overstimulating the vagal or parasympathetic drive to reset the heart, and hence it's tried in the stable patients. So the confusion may arise that, look, the carotid massage and vagal maneuver are exactly the same. Which one do I tick? But as Dr. Aima was saying, that carotid massage is contraindicated in young children, and also for that matter in older population, they want you to select the vagal maneuvers. Now, the practical tip which I wanted to leave you, dunking the child's head into a cold or ice chilled water, even though it's a part of the pathway, we don't do that regularly in emergency scenarios. We tend to take ice chilled water, we dab it in the piece of cloth or a tissue, and then put it on the face. Okay, so that will also help slow down the heart rate. Just because it's a cold water, you're just trying to provide initial stimulation, or sometimes sprinkling the cold water, like with your fingers like that, that would also drive the same mechanism. So if something like that is mentioned, again, just try to be smart in terms of your options. There could be options specifically mentioned dunking. You'll select dunking in terms of vagal maneuver and deselect carotid sinus massage, even though they all mean vagal maneuver. So you just have to be very smart in terms of your choice. And when there's unstable, it's easy. You always cardio work them.
Exactly.
Right?
And I just wanted to add that for the exam, you're gonna see some topics that we're gonna give you, or that you have to study on your own with less depth, or topics with a lot of information that we add to it. And this is because of the number of times that these topics have come up in the exam. So for example, for SVT, it's such a hot topic that we want you to have all of the information, because in the exam you might have a question about the discharge planning of the child, or when to refer to the pediatric team, or what to do after step 2 or after step 3. So you have to be able to answer all of the possible questions for that specific topic. And then we have other topics that is just a specific thing about a specific topic that they love, and that's it. They don't go into detail for anything else, and we'll give it to you. So just by doing that, just think how much time you're saving as well. Like when you have a good preparation, it will save so much. When I studied for the exam on my own, that I created a whole complete study program, and then I put into creating this course, it took me a year. But I went crazy. I studied so much. I read so many books. I had very good marks. I really had marks in the exam, but I was thinking it's not enough. I wasted a lot of time. And I always say this, I wasted so much time because no one was there to help me, to guide me. There were no books, nothing for me. So it's a waste of time. And I was depressed, I was sad, I gained like 25 kilos. I always say this because it was so bad for me, the whole process. And Dr. Aima is there. Like Dr. Aima and I used to study for 12, 14 hours a day.
Yes.
We were together studying initially, and it was a complete waste of time. So everything that you have now, it doesn't come like, there are not magical formulas for you to pass. There is no a magic course for you to do, or recalls, or whether 3 recalls, 4 do them. No, it is a lot of hard work and studying exactly what you need to study. Study is smart. How do you study in a smart way for this exam? Through guidance and through coaching. That's what we do. That's what we do in this. And I think that differs us from a lot of other academies. First, because we are in Australia and we are the only ones that are actually run by doctors, registered doctors. And second, because we offer the best quality teaching, because Dr. Rizwan it's an incredible teacher, and it's a conjoined lecturer as well, the University of Newcastle, but I also have an academic background. So we have put that level of quality into tertiary Australian education into this course, and all the heart and all our time into this. We are very passionate about IMGs, about helping people, because we had it pretty rough. I don't want to tell you about Dr. Rizwan's life, but if you don't know about it, gosh, it's pretty tough.
That's the beauty of it. It's all about the journey. And so look, thank you very much for joining, and Laura and Clay and Aima and Dr. Zara, thank you for putting a wonderful effort. I'm very glad to take you all on board again with Dr. Laura and all the team. It's going to be exciting, and I think we'll keep on doing it till we can. The other thing is, I just want to make a quick distinction, which Laura has just basically alluded to, is lots of different courses claim different pass rate. That's a very unethical claim. I think passing any exam, now I've done more exams than anybody could imagine, including PLAB and AMC and a fellowship and MRCS and all that kind of jazz. And I believe that my own study pattern was complemented by the courses. I always did courses for exam, but I used the courses to complement my own study. So when you win this game, and trust me, you will, that's your win. Nobody should claim it. It's your hard study, as Laura was saying, that she was spending a lot of time with Dr. Aima, 12 hours. It's her win. It's not across proclamation. Yes, you can say the course supported you, kept you motivated. That's fine. But that's as far as we go. If you're not putting the number of hours, if you're not putting the set amount of effort, it's never going to happen, even though AMC sits down with you question by question. You need to put your effort in. That's required. That's a discipline. And once you've put your effort in, the course will accelerate your performance. So please don't be blinded by the courses or other courses. I'm not sure that in terms of their past claims, most of these things are unethical. They're not true. It's yourself you must believe in. Will I pass? I get lots of this question. Will I pass this exam by using this course? And I don't know how to answer this question, but I just want to say, yes, you can, 100%. Don't doubt yourself. Doubt is the first uncertainty which will feed your failure. If you want to pass any exam, trust, yes, I will pass this. Yes, I will do it in 3 months of set prescribed time. And yes, I will get a job. Tell this to yourself today. And trust me, regardless, and I'm not saying that because of I'm selling my course, any course you'll do that. But you need to tell yourself, yes, the resources are excellent. The tutors are superb. That's what makes your acceleration and your own work half. But you need to put in your own discipline. Thank you once again, guys. Unless and until Laura or Zara or Aima has to say anything.
I think like that's a straight up. I find, you know, we have a massive work ethic. That's one of the things that brought us together, I think Dr. Rizwan and myself, and we everything what our students do, it's because of their effort and their hard work. You're never gonna see us really putting passing rates here or there, and it's just our students. All our students pass. We got lots of tutors that you're gonna meet that have been our students, and they actually teaching for us because they are awesome, and we support everyone through the process. You have everything, and we give you everything for you to pass. Everything, and we guide you through the process. You just need to put the hard work into, and remember, you're not doing this for just to pass AMC1. You are preparing now for your future in Australia. Okay, you are gonna be treating people here. You're gonna have to go through interview preparations, sessions, like for example with Dr. Rizwan. But if you don't have the clinical and the theory background that you're required, then you're not gonna do well. Because remember, in those interviews, you need 1 to 2 clinical questions, especially on the junior or starting level position. So just think ahead. Use the time now that you are committing into doing your theory work and your prep. Do the work now, so later it will be easier. And remember, yeah, there are gonna be people that are gonna magically pass just doing recalls and stuff, because there is a 46% chance that you will pass, but you are doing that's not good for you, for your future, for your professionalism, for you as a doctor in the future. You have to be a safe doctor first, and this is the time to do that. All right. So I'll say with me, welcome everyone, and welcome all of our students. We'll get in touch with you via email as well, with all of the steps and everything that you guys have to do during the next week, okay, in your preparation for your first lab classes. All right.
Thank you very much.
Thank you.
All right.
Thank you, everyone.
Thank you, guys.
Thank you,
Have
everyone.
so much.
great, and it's a beautiful weather these days. And
Yes.
put up the good work. Thank you.
Thank you, guys.
Enjoy.
Thank you.
Thank
And
you.
if you want more info, check the YouTube channel. Like, we've gone
Yeah.
through a lot of tips, tricks, and stuff in all the videos, and they are all in Emergency Focus YouTube channel. Like, we talk about the process and everything there. All right. Thank you, guys. Pleasure. Thank you, Dr. Rizwan.
Thank you, Laura.
Thank you,
Thank you
Dr.
so much.
Thank you so
Dr.
much.
Rizwan.
Thank you, everyone.
Thank you, doctor.
See you guys.
Ciao.
Thank you.
Bye-bye.